Did you know that all of us have a second heart in our bodies? Welcome back to the channel, folks. Dr. Sharma here, physician, board-certified psychiatrist, and Air Force veteran. As always, I wanted to mention that this video is for informational purposes only. It is not medical or psychiatric advice. So you're probably thinking, what in the world is Doc talking about? A second heart in our bodies? Well, that's right. This term, the second heart, is used to describe our calf muscles. These muscles are essential for pumping blood back up from our lower extremities to our heart. Every time we walk, run, or even stand, our calf muscles contract and squeeze the veins in our legs, pushing blood upwards against gravity. This mechanism is really important for maintaining healthy blood circulation and preventing issues like varicose veins, blood clots, and it can really improve our overall cardiac health. I'm bringing this topic up because it not only improves physical health, but also mental health. Recently, I started walking long distances. I did this because it's low impact activity and it can be really meditative. Low impact activities are really important also for folks who have any musculoskeletal issues in the lower extremities, like guess who? Veterans, right? More on that in a minute. When I say long distances, I mean about 8,000 to 10,000 steps per day when possible. What I found was that almost instantly I felt better physically, meaning my core felt stronger. I felt more intentional with my movements and basically where my body was moving in the environment. And I felt like it was a very sustainable activity long term. And mentally, my mood improved. I felt more positive about the future, and I even had more energy when waking up in the mornings, which with a baby at home, that means a lot. Walking is one of the best ways to keep our second heart active. When we walk, our calf muscles work continuously, ensuring that blood flows smoothly back to our heart. This is especially important for those of us who spend a lot of time sitting or standing still, because inactivity can lead to blood basically pooling in the legs and causing circulatory problems. So I was talking about physical benefits before, just from what I've noticed, but what about the science? It actually helps improve cardiovascular fitness, it strengthens our bones, reduces excess body fat, and boosts muscle power and endurance. All of this has been shown in studies. As always, I'll have my references in the description. So like I was saying before, for veterans and others with musculoskeletal issues, walking is a low impact exercise that can be easier on the joints compared to high impact activities like running. This makes it an excellent choice for maintaining physical health without worsening any existing injuries that you might have. So after years of doing marching, ruck marches, humps, whatever the case may be in the military, we know this takes a toll on the joints, mainly the knees and the ankles. Now, we also know whenever one joint is affected, the joints above and below are also affected. So this means the hips and lower back will be affected as well. So we avoid re-injuring those areas by choosing low impact activities like walking. Walking also has a significant impact on mental health. So regular walking can reduce symptoms of anxiety and depression, improve mood, boost overall mental well-being. It increases blood flow to the brain, which can increase cognitive function and reduce feelings of stress. For veterans, especially dealing with PTSD, depression, anxiety, or other mental health challenges, incorporating walking into your routine can be a powerful tool for managing symptoms and improving your overall quality of life. And you guys know me, I talk about quality of life a lot, and this is very important. When I say this, I'm also talking about our mobility. We don't want to get older and not be able to get around the house, get to the toilet, take care of ourselves. We want to maintain our independence as long as we can as we get older. And this directly relates to our quality of life. Now, obviously, sometimes it's unavoidable, right? Especially if we're hit with some kind of medical illness like a stroke or a heart attack. But if we can decrease the risk of becoming immobile or having these medical issues, we should do our best for ourselves and for our families. I also want to talk about this very important study by Professor Mark Hamilton at the University of Houston. His team specifically looked at the soleus muscle, which is a muscle in the calf that runs just below the knee down to the heel. They had people do what they call soleus push-ups, which is, if you can imagine, even when you're sitting, pushing up on your feet almost like you're going to your tiptoes and coming back. So yes, this exercise can be done even when sitting. So let's say you have a physical condition that prevents you from standing, or you have a job that requires a lot of sitting. You can still do this activity. Doing these soleus push-ups can actually increase muscle metabolism for hours afterwards. It also helps regulate blood glucose levels even more effectively than traditional exercise, weight loss, or intermittent fasting. What it comes down to is that the soleus muscle is able to use blood glucose and fats as fuel rather than glycogen. So it can work for extended periods of time without fatigue. And yes, more research does need to be done on this, but it's very promising and it's easy for all of us to do even when sitting down. So how can you incorporate more walking into your daily routine? Here are some tips. Start small. Begin with short walks and gradually increase your distance and pace. There is nothing wrong with walking for a few blocks at a time and slowly increasing it every few days or every few weeks. We have to start wherever we are at. Make it social. Drag some family members or friends with you. Walking with others can make the activity more enjoyable, and of course, having these interactions with others improves our overall mental health. This also means that you'll have an accountability partner to keep you honest and vice versa. Set goals. Set realistic goals for yourself, like walking for 30 minutes a day, 5 days a week, or however long based on your current activity level and endurance. Choose the right footwear. Remember, you don't want to do this in flip-flops or something not designed for walking or running. You don't want to injure yourself or re-injure yourself. So get some good walking or running shoes and make sure you're comfortable. Mix it up. Remember, we can get rigid with our routines at times, so you want to explore different routes and environments to keep things interesting. Walking the same route can get pretty boring, so feel free to switch it up. Walking in nature can also be really beneficial for mental health too, so walking trails in parks, gardens, things like that. That's it for today's video. I hope this was helpful for you to take a deeper look at how we can improve our mobility, cardiovascular health, and mental health. I know this topic was a little bit different from what we usually tackle, but it's really important for all of us to keep in mind for overall health, mental well-being, and quality of life. I've got the references for the studies I used to make this video in the description. If you found this video helpful, please like, comment, and subscribe to my channel. It really helps, and it tells me that I'm doing something right. Also, please drop a comment below about your thoughts on the topic, and if you have any requests on what to cover in the future, I'd be happy to make a video on it. Remember, I also have an online course for veterans with PTSD and anxiety. Check out the link in the description. As always, thanks for watching. Dr. Sharma signing off. See you next time.